In 2005, the Ellen Shaw de Paredes Breast Cancer Foundation was established. Its mission is clear. Its message is hopeful. Guided by internationally recognized imaging specialist Dr. Ellen Shaw de Paredes, the foundation focuses on programs supporting the early detection of breast cancer.
My passion, my vision is really that, as far as the foundation is concerned and my work is concerned, that women would no longer have to die of breast cancer. And how can we accomplish that? How can we accomplish it locally, regionally, and on a much broader scale is through programs such as the foundation conducts, our free screening, our outreach program, which touches the lives of many women who've never been served as far as breast cancer detection is concerned, education of physicians and the public, education of radiologists to be experts in the field so that they can find cancer earlier and allow it to be cured, as opposed to being a late-stage cancer that's going to potentially kill that patient.
Through its free mammography outreach program, each year the foundation provides complete breast health services to hundreds of women in the Richmond area, women who live in fear that they cannot afford treatment. Avis Binford was relieved to find the outreach program when she fell on hard times.
So sometimes you get slammed after you get slammed. And so it's nice that there are places like this that, for me, hold up the bottom because the basement can get lower. This particular outreach program gives me just a little bit more room to breathe and to function, which gives me a chance of being more productive and hopefully re-entering a more normal, stable life.
The foundation works for community awareness of the need for early detection, particularly among the underserved population.
What really hurts me, what really troubles me and touches me in such a profound way in what I do is to see a woman walk in the door with advanced breast cancer when I know it shouldn't happen.
Last year, 2013, I found my cancer again back in my left breast. And it was very hard because my husband, we didn't have insurance again because his insurance had gone up so high we couldn't afford it. The doctor saw me, felt the lump, said I needed a mammogram, and sent me home with a number to call their financial people, which I did, and we didn't qualify. They said, well, hold on, I'll give you a couple of numbers. It was Dr. Paredes' office, and they got me in right away, and a nurse came in, and the first thing she did was she goes, I have a voucher for you. This will cover your mammogram and your ultrasound. And I looked at her and said, but I need a biopsy too. What do I do about that? She said, Dr. Paredes is going to do that and not charge you for it. And I was in tears. Since then, I have had a bilateral mastectomy. I've had CAT scans and PET scans done where they found small nodes in my lungs. I've had lung surgery to find out that the breast cancer has spread to my lungs, but they're small, so it's early.
Through our foundation's outreach program, what really troubles me is that a number of the women we've seen whom we diagnose with breast cancer have presented with stage 4 disease, and that's a rarity in my own clinical practice. Most of our patients we pick up with stage 1 disease and are cured, but a number of our patients through the outreach have had stage 4 disease, again because they had no services or access to services that led to an earlier detection of their cancer.
In addition to its support for local women, the foundation provides educational programs which greatly expand the organization's reach.
Teaching fellows is really one of my favorite things that I do, and it's really one of the most important programs our foundation supports. Fellows are radiologists who've completed their training in radiology and want to specialize in breast imaging. And through their work, we can extend our touch to women around the world.
Dr. Amen came from Burma, where he had fought in the jungle. It is a country served by 5 mammography units. He values the intensive education of his fellowship in breast imaging.
To come here and get training specialized in breast imaging, it's difficult. To good teaching hospital, they don't have like fellow programs like this. And also expense-wise, it's pretty challenging, and so I think this program is important in terms of connecting and helping women all around the world.
Over the years, I've trained about 35, 36 fellows. Most of them are practicing either solely in breast imaging or at least largely in the area of breast imaging. I alone can see maybe 25,000 patients a year, but each fellow can see that many as well. So through my work, through the Foundation's work in educating fellows, we are able to touch the lives of hundreds of thousands of women each year.
Dr. P, as the fellows call her, shares her expertise as well as her philosophy of caring.
The thought of the changing somebody else's life, your heart, put your heart in it. That's what she made us.
The Foundation's educational series of seminars provide accredited continuing medical education to doctors and technologists across the country. Dr. Eric Raudiola recently attended his 3rd weekend, this one covering the new 3D imaging called tomosynthesis.
She is passionate about her patients, and that transfers to the people that are learning from her. She believes that everyone that has breast cancer has hope for survival, and hope seems to permeate this practice.
The work of the Ellen Shaw de Paredes Breast Cancer Foundation in the area of early detection of breast cancer is the hope for the future.
Through your support, through the support of our friends, companies, individuals, volunteers, we're able to expand our reach, we're able to help more and more women, we're able to help educate more physicians, and we're really able to help make a big difference.
So while I'm not fortunate or don't feel fortunate to be in my current financial circumstances, I do feel blessed to benefit from the services of the outreach program and to find some comfort where I can.
And this foundation, every penny you spend will help save a life, will help at least give that woman or that person a chance to live a life, to be there for their family. And it would not be a penny wasted, even if it was just one life that you saved. And you've already done that with me.